All right, I see it's 3:30, so we'll call a executive meeting of the Dunn County Board of Supervisors to order Wednesday, January 12th. And I think everybody's here. That's great. Approval of the minutes.
I move we approve.
I'll second, Mr. Chairman.
All right. Any discussion? Not, all in favor, say aye.
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 Opposed? Motion carried. Public comments. Krista, do we have any public comments?
No public comment.
Thank you. Move into the county manager report. Welcome, Beata.
Yeah, I wanted to take a moment to introduce you all to our new CFO, Beata Haug. She started with us last week, so she's already been here a long time. There's a lot to learn, obviously, but Beata actually worked previously for Dunn County several years back, and then went on to St. Croix County, and then Washington County in Minnesota. And we were lucky enough to pick her up and get her back here to be our new CFO, replacing Keith, whose last day will be at the end of this month. Beata, do you want to take a moment to introduce yourself to the executive committee? You are muted.
Thank you. Thank you for the reminder. First of all, thank you, Mr. Miller, for the great introduction. And also thank you so much to this committee for giving me this opportunity to be part of this community and utilize my experience to really take us to our to the next step so that we can reach our goals, our missions, and our objectives. So I am honored to be part of this team. Mr. Miller, can I give up some background of
Sure.
my experience? So I've been in the government sector since 2003, started in Eau Claire County and kind of stayed on the western side of Wisconsin and went as far as Minnesota. So as I've been throughout these different municipalities, I've also been gaining a lot of experiences. So there's a lot of common interest with a lot of Wisconsin and including state counties as far as our deliverables and what is it that we do, we as a public servant, but we all have different way of accomplishing that. So different systems and so on. So I am very excited to dive into my new role and start making some progress. So again, thank you for allowing me this opportunity. It's an honor.
Welcome aboard.
Thank you
Welcome
very much.
Yes.
Welcome
Thank you.
aboard.
Good to have
Beata.
you.
Thank you.
Welcome.
Pleasure is all mine. Thank you.
Moving on, you have the draft agenda for the January 19 County Board meeting in your packets. Going over them very quickly, giving you the opportunity not only to know what we have planned, but to address anything that we haven't put in there. You'll note under acknowledgements, presentation of memorials or communications, we've got a number of people retiring with a lot of years behind them. We've been seeing this for the past 5 years that I've been here. Kathy Myers in Human Services, 42 years. And then Diane Bird in Social Services, 39 years. I mean, we've got a lot of people who have worked a long time for us. They're valued and treasured, but they've reached that point where they've earned the next chapter of their lives. So we'll get a chance to acknowledge them. Under my report, I intend to give an update on COVID-19. It's very timely. We'll be talking, in fact, about COVID-19 as part of this meeting. I will take the opportunity to introduce Beata to the entire county board at the meeting on the 19th. And of course, go over the purchase orders in excess of 40,000. The Dunn County Housing Authority is scheduled for its annual report at our meeting on the 19th. It's already been submitted. And as we have been doing, we're not anticipating an actual presentation by the Housing Authority, but we'll invite somebody to be there to answer any questions that anybody may have. And then under actions by the committees, we've got the second reading on the land division ordinance that we want to do. We want to approve the labor agreement with our powers of arrest union. And we have two items that are coming to the board from Human Services, Health and Human Services Board. Supervisor Morehouse and Chris Corpola will address that a little bit later in this meeting. Finally, from the executive committee, we have the resolution that will dissolve the Public Works Department and create three departments: highway, transit, and facilities. Each of the standing committees that oversee those divisions have endorsed the idea of them being separate departments. And one item that's been added is this declaration of an emergency related to COVID-19 that we'll address a little bit later. I have not put down in here in the draft an opportunity for oral reports on standing committees, but I don't know if any of the standing committee chairs would like that opportunity to make an oral presentation to the board at that meeting. If not, go ahead.
Mr. Chairman.
Supervisor Morehouse.
Thank you, Mr. Chairman. I don't have a report to make, but do give a robust COVID update.
Oh, yeah.
That obviously necessary for our discussion, but I'll trust you to do that.
Yes, and we'll invite KT to
Perfect.
participate as well. Other than that, unless there's any other items to add to the agenda, that's what we have for the meeting on the 19th.
All right, I'll just comment that the 4 people that are retiring, that's 128 years, I believe.
Mhm.
And I think that's the most that we've lost at one time for a lot of dedication there. It's unbelievable. Moving on, 6. I have nothing placed at the request of the chair, but Kristen Corpola reached out to me and asked what I was going to do about Sarah Kennedy's spot on the board. And I just thought I'd mention that my intent was not to appoint anybody. It's about 3 months of meetings. And I thought we could get along without that and wait until the election. So if somebody feels strongly that we should be doing something different, let me know. But that was my intent.
Mr. Chair,
Yes.
I'm going to assume that nobody's approached you with any interest in that position.
No, there is one person on the ballot.
But in terms of being appointed prior to the election.
Right. Nobody's approached me. No.
Okay, thank you.
Moving on to number 7 then, consideration of actions to be taken by the executive committee. There is none. Number 8, consideration of reports, resolutions, and ordinances to the county board from the executive committee. We have a resolution declaring a state of emergency. Mr. Miller, earlier in the week, actually Monday, I believe it was, thought maybe I should sign declaration of emergency and asking some questions. I didn't see that we gained a lot by doing that. So I thought I would bring it to this committee, and I will sign it if you believe we should, and it'll go on to county board. And Mr. Miller, do you want to take it from there?
My part of it will be to say that what the sole purpose of the declaration that we talked about the county board chair signing was to give us coverage before the full county board could act on the 19th. So the remainder of this week and the first part of next week. But both the declaration and the resolution, the proclamation regarding the state of emergency, are tied to the serious and substantial surge in COVID-19 cases that we are experiencing, and the desire to enable staff to take necessary or appropriate additional steps to safeguard staff and visitors to public county-owned buildings and facilities. With your indulgence, I would invite KT Gallagher, our public health director, to address the current state of that surge and its implications for public health. KT?
All right, thank you guys. So yes, we are in the highest rate of cases that we've been in the entire pandemic. We have a 7-day average of 90 cases a day and increasing. If you look at the CDC's websites, we actually are over 10 times higher their designation of high community transmission rate. And we are seeing a staggering percent positivity. Over 1 in 4 people who are tested test positive, acknowledging that there are some confounding variables in that. Many people are going in to confirm their home test, and so that there is a little bit of that, but we're still seeing a really high level of testing. So I don't think that that's the only reason. We are seeing spread in a way that we've not seen before. We're seeing infection among people that are fully vaccinated and boosted in a way we haven't seen before. And we're seeing infection or reinfection in people that have been sick with COVID relatively recently. Sometimes even earlier than 3 months ago, we'll see another test positive. So given that number of cases, the spread and the ability to have spread among people that are fully vaccinated and boosted, my concern is that we're going to start to see additional spread among work groups and spread potentially from folks coming in from the outside of the county, coming in either on their updated 5+5 isolation period within their masking or not masking, and or visitors. I think something to be aware of is that we have had, and I do want to just acknowledge that the neighbors is a very different situation that the county building is at large, but there has been exposure and transmission from a visitor in the neighbors group. So that's for awareness. We have had work groups within the county family that have had spread among the work group related to gatherings and work connections. And I think that that's going to increase with the increased transmissibility for the Omicron variant that we're seeing now. Any other points of information that I can share with you today?
Mr. Chair,
Supervisor Tripp.
KT, I heard somewhere in the news the other day that the goal for masking now is not so much to prevent the spread, but to reduce the burden on the medical system. Can you comment on that and how that might relate in Dunn County?
So I think there's a both and. I think that there is a need to reduce the spread, and there is kind of this risk balance that is calculated within the CDC's 5+5 isolation, there is still a known risk of being able to transmit the illness on days 6, 7, and 8. But the balance is that we need to have doors open and the economy working and people working. I think our healthcare systems continue to be very stretched thin as their healthcare workers are having to stay out because they're COVID positive. And because we do continue to see people that are hospitalized and have been hospitalized for a long time with COVID. There's a question about decoupling of hospitalizations with infection rates. Our hospitalizations have gone down. Right now, we're sitting with 7 people in Dunn County that are hospitalized because of COVID. And I want to make that point, because of COVID. If you look at our hospitalizations, just what's put forward by our health systems, that is higher. But that's they have COVID and they're hospitalized number that we're looking at. Did I answer your question?
Supervisor Morehouse.
Thank you, Mr. Chairman. Katie, how is your staff holding up under this enormous burden? I'm always concerned about that, and I'm very concerned now. This is pretty crazy.
Definitely filed under pretty crazy. So we are able to physically touch about 70 cases a day with our current staffing. We are prioritizing very quick interviews to make sure that we understand that they've been notified, that they don't have any barriers to isolate, that they know when they can return to work and then when they can return maskless. And then connecting with any household contacts. We're prioritizing people at risk for severe illness, unvaccinated people, people that are 60 or better, and then people that are at risk for spreading. So children that are school-aged, people that are connected to a long-term care facility. So with that prioritization, we are still very much underwater, and it's very challenging when people say, I had a call just a couple hours ago saying it's been 7 days since I tested positive. I didn't talk to anybody. Can I go back to work? Can I get a letter for work? Person worked in a bank. They were relatively young and relatively healthy and not connected to another case. They didn't get a call from us. They did get a letter. But that was not sufficient for that individual to go back to work. And so I think we continue to have rough edges around notification. They know that they were positive, but they may not know what next for them. We're taking it day by day and recognizing that we are doing our best, but I wish we could do more.
Supervisor Steen.
Thank you, Mr. Chair. Katie, from what I'm able to observe on the screen, it appears that this Omicron has a sharp increase, and they're saying it's going to be a sharp decrease. What's your thoughts on that?
That's absolutely my hope, is that we'll burn hot and we'll burn fast. But I don't know that I have a crystal ball that can really say what that's going to look like for us. There's a lot of projections about 3 to 4 weeks before we start turning downwards. But I will tell you that 3 to 4 weeks like this is going to be a heck of a 3 to 4 week period for Dunn County.
Thank you.
Mr. Miller, or why don't we go with Supervisor Quinn first? No? Oh, I saw your hand up.
Yeah, no,
All right. Mr. Miller.
What I wanted to point out then, what's in front of the executive committee and then what we want to bring in front of the county board, again, would authorize staff to impose additional policies or procedures in response. I wanted to address one we did last year was we closed the buildings to the public and allowed people in by appointment only. I wanted to point out we're not talking about, we're not at that point yet here. We're not convinced, staff that is, that there would be a lot of value to closing the doors. But one thing we do need to, we're evaluating right now, and we do need to consider is consequences for travel. We have a lot of people that have signed up to go to conferences or that are going on vacations. And with the Omicron variant being so transmissible, should we have a mandatory 5-day quarantine upon return before they return to the workplace? We haven't resolved that yet. The goal of this proclamation from the county board chair and ultimately the resolution from the county board would be to endorse those steps once we've worked through. And when we work it through, by the way, it's the COVID response team, it's KT, but it's also Heather Murray, from our HR director, and then various department heads that represent across the board the departments and divisions of county government. When we do agree that a step needs to be taken, the resolution would give overt endorsement by the county board for those steps. And of course, we'll keep everybody informed if any additional protocols are put in place.
Supervisor Steen.
Yes, thank you, Chairman. Mr. Miller, reading your proclamation here or your resolution, it appears to me that the brunt or about 100% of this concerns the county employees. My question is, how much would this impact the general public, if at all, in their interaction with the county government?
Well, there's a number of ways in which it can. The degree of impact, I don't know, but obviously it does have a consequence for anybody who visits a county building or facility, but it also has a consequence for anybody that a county employee comes in contact with outside of the workplace. If we can keep our employees safer, then hopefully they are safer when they come back in touch with their family, neighbors, or even casual contact when they're out grocery shopping or whatever else. So it's hard to put a measure on the potential consequence for the community as a whole. But I certainly think it is worth doing for the safety of county employees, of the visitors to the county buildings and facilities. And it's also an example of leading by our behavior, leading by example.
I guess additionally, let's just say, excuse me.
Yeah, Supervisor Headland had his hand up first.
Thank you, Mr. Chair. A question I have is in some areas, there's been a shortage showing up in terms of tests, especially the quality tests. How are we in Dunn County? I realize there's, we have Walgreens, Walmart, and so on and so forth, but I'm wondering if we're at a critical point with those.
Sure. So there is, so as the federal government really ramps up their plan to get antigen testing into more people's hands in their homes, some of the allocations to states and to folks that already had purchase orders in have changed. And so that has been felt acutely in our school age testing sites. So you may know that the Menominee Area School District does have a testing site available to their families and staff, and Boyceville and Elk Mound are looking to come online with a similar testing site here shortly. So those school districts aren't able to use antigen tests. So those are the probable cases, the rapid tests, because there is a shortage. There is not a shortage of PCR tests. The challenge with PCR tests is that there is typically, in a good day, a 2-day turnaround time. And as testing increases, that turnaround time can then be longer until you're already waiting 5 days from when your symptoms started before you actually have that answer in hand. So it is a challenge. We still do continue to have, we are well covered with testing from the UW Stout Community Testing Site, our providers testing folks, as well as the schools. But I think that is something that will rapidly change. We're already hearing from the school districts and from some of our providers that if somebody tests positive at home with a home antigen test, they don't want to use that resource to confirm that test. So I think that it will be more of a stretch before it gets easier as the manufacturers are continuing to ramp up production. And that is a concern for me.
Supervisor Steen, you had something?
Yeah, but the train left the station. I forgot.
All right. Supervisor Quinn.
Yeah, I guess I have a couple of questions. What I don't recall seeing a time frame on the document. Is there one?
Yes, as opposed to picking a date. I mean, it would be effective upon adoption, but as opposed to picking a date for sunsetting it, what this one is doing is tying it to the rate of transmission. So it stipulates that if our incidences drop below the high transmission rate for a period of, as established by the CDC, so it's an external measure for a period of 7 consecutive days, then the emergency order would end.
And is there a reason why we couldn't simply establish a policy as a board directing these things?
The difficulty there, Supervisor Quinn, is that this is still a fluid situation. And there may be need based on today's events to adapt or modify a protocol or adopt a new one. If it has to take county board action every time, there are understandable delays. What this proclamation and resolution does is it allows, it's an acknowledgement by the county board of the fluid nature of the need to be able to potentially react swiftly. And it simply gives to staff the authority that's needed to make those moves. Understanding too that we've written it overtly to say that the staff does it in consultation with the director of public health and the county board chair. I mean, it's not like any one person is going to be saying today I decide we're going to do X, Y, or Z. But there's a couple of things. I mentioned travel. I mentioned closing the buildings. But as KT was talking about, is the use of an at-home test going to be sufficient for determining status? If it says no, are we going to accept that? We haven't worked through that, but better data may be coming, better information on that may be coming, and we want to be able to perhaps adjust to that, to say, maybe initially we say an at-home test is inadequate, but subsequently we say it's apparently it's okay, so it is adequate. Those kinds of changes may need to be made on the fly. And if we have to take it in front of the county board every time for an amendment to an actual adopted policy, it would seriously burden the responsiveness.
I don't know if Nick can answer some of these questions on what our policy is. Probably the biggest reason I didn't sign it right away is that after talking it over with Heather and Nick, it appeared that closing the buildings were probably the biggest significant difference in whether I sign this or not. Mr. Miller has authority to have people work from home, to wear masks in the buildings. And we do have policies about travel, quarantining for 5 days after you come back, and not at this time, not being able to use a home test, that we don't accept that. Nick, can you enlighten us more on that stuff?
Yeah, so I'll try to. So there is a policy called COVID-19 modified policies and procedures. These are temporary policies that have been approved by the Committee on Administration. The last meeting, I think, or maybe before, there was some discussion of it. The current policy that we have is effective as of January 1st of this year. Now, it does provide employees are responsible for notifying their immediate supervisor if they've had exposure, if they've been tested for any reason, if they've tested positive, and if they're experiencing any symptoms. Supervisors are responsible for working with human resources as soon as they learn of an employee who's been exposed, has been tested positive, or experiencing any symptoms. Human resources then does follow up with that. There are notification requirements. Employees are expected to notify their, and I apologize for looking down, I'm reading. Employees are expected to notify their immediate supervisor as soon as possible if they've been tested, if they receive a positive, if they've been tested for any reason, if they receive a positive test, if they've been exposed to or received notice that they've had close contact, or if they begin to exhibit symptoms. If symptoms begin during the workday, that must be reported as supervisor immediately. Failure to follow through with any of that stuff could lead to discipline. The county has a reporting requirement, a notification requirement. The policy provides that the county has the right to require a test for an employee at any time. We have masking already in place. There, people who enter the building, I'm not 100%, I guess, but I think almost everyone that enters the building puts a mask on. The buildings are, and I can only, I guess, speak for the government center. There are signs at the entrances saying you have to wear a mask, and there are masks provided so that people can take them. Let's see. And I did talk this over with the HR director. And she believes that some of these things, so there's nothing in here that clearly relates to travel. But she believes that that's a matter of procedure that can be implemented, I guess lawfully isn't the right word, but it can be implemented under the auspices of this policy as a matter of procedure, because it relates to the governance and management of the workforce, and it fits like a puzzle piece in with all this other stuff about being exposed. But my understanding, KT can chime in when I'm done here if I'm wrong, but my understanding is that the CDC has not yet established there isn't a current guideline for travel like there was when we first had COVID. I don't know if you recall, at one time, states were categorized as, high spread states. And so like if you went into Minnesota, you had to, you were required to wear a mask, and employees were told not to go to certain things or certain places, certain areas. And there currently, there isn't anything like that right now. And so the county is just using the procedures that are already in place and evaluating employee travel, whether it's vacation or going to a conference, to determine whether or not any of these other measures should be followed. But there isn't a specific policy that relates to travel. My thought about the emergency order was probably the most critical factor for having it was whether or not the doors are locked. So access that's a very substantial impact to the delivery of services to the citizens of Dunn County and people who need to do business in county facilities. And once it was determined that that wasn't going to be a part of it, not saying that it wouldn't be in the future, but at least at this point, that had a big impact on my thought about whether or not it was strictly speaking necessary to declare an emergency. Now, I'm not advocating for or against it. I'm just telling you that a lot of the things that, as one supervisor noted, this is very focused on county employees in county buildings, doing county business and interacting with members of the public. And it was designed that way specifically. That's what I was requested to draft. And the only real editing that I've done, other than I'll note, I have changed the county clerk's name in the resolution. But I used one from last year or 2 years ago. Other than that, the only editing was to remove the access to facilities, securing the doors and requiring appointments out. And so it is very oriented towards county employees and as they do their jobs and conduct their work in county facilities. The policy allows for people so there's no more emergency leave, but employees can take leave, even if their leave balance is low, and take leave and offset it against future accruals. There's a leave donation policy that's in here. Very often when someone needs leave and they can request help from their coworkers, and an email goes out and it says, someone needs leave. If you would like to donate, you can. So there's that process in there. The emergency responder, eligible employees are still able, they're still able to utilize vacation, sick leave, or unpaid leave to cover and, to be absent from the workplace if they need to because of their, school closes. So a parent has to go home and take care of 3 kids or something. There's a mechanism in there for that. And so a lot of this is covered by county policy, and the policy has been largely, from a formal standpoint, it's been approved by the Committee on Administration. And if anyone has any more questions, you can ask, but I'm going to, I think that's all that I have on this, all of my notes. And then I have the policy here in front of me.
Supervisor Steen.
Yes, this could be for Nick or Paul or Dave, any of you. In the proclamation declaring the state of emergency, I think if I read it correctly, we got the wording in there for the high transmission rate for 7 consecutive days, but we also have the ability of the county board to end it.
Yes.
On the resolution, and I got to apologize for my printer because it crapped out halfway through printing the resolution, but do we have that same wording in that?
No, because the proclamation is the county board chair coming forward at a time when the county board isn't in session and making it sort of acting as the county board. And so it's basically, it's just saying the county board can adopt this or set a different end time, and at any time can end it. You could, even if the transmission rate doesn't come below, you could do a resolution saying the emergency is over.
Yeah, thank you. That answers my question.
Yeah.
I was going to make one statement, then we'll hear from Mr. Miller. thinking about this, the only thing that I had thought of that I could see good coming out of signing this is that we're notifying the public that we feel there is an emergency. And so I guess I didn't want to sign it because I didn't think there was anything that would change than what we have right now. But I did think of that since Monday, that would be a positive note of signing this. Mr. Miller, do you have something?
One other consideration on the resolution is the cover it provides staff. We all know that KT and her staff have taken blowback in a lot of instances from people who disagree with even recommendations on safety protocols. And so part of the purpose of the resolution declaring the state of emergency is the county board overtly saying, look, we support what staff is doing, as opposed to if we operate under, we already have the authority, administration already has the authority to require, or tell people they have to work from home if they're non-essential, or to wear masks when away from their desks, or et cetera. We already have those authorities. What we don't have in those instances is covered by the county board. And it means that we are vulnerable again, and I'm particularly concerned about the public health staff, to the accusations of abusing power and requiring unnecessary things. The acknowledgement by the county board that there's an emergency that justifies these actions, I feel, is very important.
Supervisor Quinn and then Supervisor Morehouse.
Yeah, I think I can understand Chairman Bartlett's statement and also County Manager Miller's statement. However, I think my instincts would be that we could pretty much accomplish those aims by crafting and issuing a resolution from the board that reaffirms all of these things and the necessity for them, and emphasizes the new conditions that are out there, calling on our neighbors to join us in doing this. And we wouldn't need to do that with an emergency proclamation. We could do that with a strong and united statement from the board.
Supervisor Morehouse.
Thank you, Mr. Chairman. And I just thought of this listening to Supervisor Quinn. We did that. Chairman Bartlett and I signed, I don't even remember what we called it, a letter indicating that this was pretty serious and urging our constituents and residents of the county to follow through. We didn't get 100% signature from the board. So that's just a consideration. My thoughts on this are, I understand somewhat the reluctance to declare a state of emergency, but I think we should not discount the fact that we have a leadership role, both to our employees and to the residents of the county. This is, I think this is very serious, and I think it should be taken more seriously than it appears to have been. So I think in terms of providing leadership to the county, providing, I guess I don't want to call it cover, but providing a statement of support to our staff who have done such an incredible job, and a statement to county employees that says, look, this is important, and the board takes it seriously, and we're asking you to do the same.
So any other discussion? Somebody want to make a motion to do nothing, to do something like Supervisor Quinn mentioned, or to ask me to sign this declaration of emergency? Supervisor Greb.
First of all, would you clarify? I think we've been talking about two different documents here, and I'm sometimes I think we're getting a little confused. Do you first want a motion asking you to sign the declaration? Is that what you're asking for?
I guess I'm asking for a motion to do something. Supervisor Quinn offered another suggestion that would take a resolution straight to county board, and we would not sign a emergency direct declaration. I guess the other option is that we do nothing because we do have policies in place.
And if at this, Mr. Chair, may I just clarify?
Yes.
At this point in time, see, the proclamation of an emergency is done by the county board chair, and it has to be ratified by the county board. And so they come together as a package. If the county board chair were to sign the proclamation of emergency, it would come into effect immediately, but it would still be necessary for the county board to meet, discuss it, and ratify it in order for it to continue into effect. Given
Thank
the
you,
timing
because-
that we're in, we have time to do that, so.
Well, part of my question is there kind of a logical or a necessary sequence here?
Yeah.
Do we need to deal with the proclamation by the board chair first, or could we bypass that? Because otherwise I would make a motion that
You could.
the executive committee recommend the resolution declaring the state of emergency.
That is an option.
Is there a logical sequence though? That's what I'm asking. Would it make more sense? Would it be more efficacious to clarify the statement from the county board chair first?
Huh. Well,
Because if that's the case, then I would make a motion asking the county board chair to sign the declaration.
it could have value in that it would take effect right away.
Can I make both motions?
Well, I'll say this, if there's a motion to have the county board chair sign the proclamation, there will be a resolution that comes to the county board to ratify it. And if the county board were to adopt it, it would be the county board's emergency declaration at that point and not the board chairs. And if the county board elected not to ratify it, it would come to an end. And so I think if the motion would be to have the county board chair sign a proclamation of emergency, it would come as a matter of course that there would be a resolution advanced to the county board. If you weren't going to meet in 2 months, I would insist that you try to find a time next week to deal with it. But you're meeting next week, so it should be included in your packet.
Mr. Chairman, with your permission, after hearing all that, I will make a motion that the executive committee recommend to the county board passage of the resolution declaring a state of emergency.
I will second Supervisor Tripp's motion.
May I speak to the motion just briefly?
Yes, go ahead.
I think one of the complaints, not complaints, but one of the things that people might be concerned about is the turning over to the county manager a role that rightfully belongs to the Board of Supervisors. I don't necessarily agree with that, and I think the language in this resolution clearly states that the county manager, in consultation with the public health director and the county board chair, is authorized to take. What I think might be helpful is to add a little bit of stronger language in the next be it resolved, where the county manager shall report to the Committee on Administration, the Executive Committee, and the board on all actions. If somehow we could put some language in there that says that at that point, he will verify having accepted the recommendations. I'm not married to this. I'm just looking forward to the possibility that people will object because we're turning over the powers that we rightfully have to our hired help. So if that language in the last, be it further resolved, were to more directly state that when the county manager reported, it would be that he had in consultation or on the advice of, I think that would make some people a little bit more comfortable with the resolution. I could vote for it. As a matter of fact, I made the motion the way it is. But I'm looking forward to possible objections that people might have. I'd like to get them out of the way beforehand rather than wait until deal with it afterwards.
And I wholeheartedly agree with the sentiment, Supervisor Tripp. That's exactly in concert with the concern that we had, that people perceive that staff was taking authority onto itself, which it shouldn't have. That's why we think it's important it be in front of the county board.
Yeah, I really do appreciate the fact that that reporting is in there, because while it's on a number of occasions in the past, I have said that it's the reporting that helps us to keep track of what's going on. So I do like that. If we could strengthen that language a little bit, I think it might assuage some of the concerns that some folks might have with this.
Okay, we have a motion on the floor. Do we have a second?
Yeah.
Supervisor McCullough.
Yes,
Oh.
I'd seconded.
That's right. All right.
No.
And with your motion, you're not directing me to sign this declaration, then we're going to wait until county board. Is that correct?
My motion only is to recommend the resolution. I don't know what the hell is happening with that statement that you're making.
Okay. So Mick, would you like to let me know now? Are we saying we're going to sign the declaration of emergency or not?
No.
We're not, right?
The terms of Supervisor Tripp's motion do not lead to that conclusion.
That's
So that
what
part
I
is
understood.
omitted. Right.
Okay. I just wanted everybody to be clear, because that's the way I was thinking he meant, but I wanted to make sure. Supervisor Steen.
Yes, I think we're talking about two separate things. I would look at it as the resolution is standing on its own, and I would look at the declaration or the proclamation is standing on its own. And while I am somewhat uncomfortable with it, as county board chair, the buck stops there. And if you think in consultation with your director and the public health person that this is what has to be done, I think it certainly is within your purview to do that, because that is ultimately your responsibility. So I just wanted to express that thought.
And I understand that. Thank you. I had reservations because I did think we were gaining a lot. So we're going to bring the resolution to the county board. That's what this motion states, and not the declaration of emergency.
Is Supervisor Tripp's recommendation for language that has, so as part of the county manager's report, there would have to be some detail about the consultation with the health director and the board chair.
And reporting to admin and executive.
Yeah, right. That's in there. Just the detail about, or just additional information, or capture that in additional information about the details of the consultation.
Right.
Right. I can do that.
Any other discussion before we vote? Supervisor Quinn.
Yeah, I am still concerned that that all of everything I've heard so far with regard to what this policy is going to accomplish is already in our current policy. And as I understand it, that policy has been approved by the Committee on Administration. So the Committee on Administration, I would assume, has the ability to impose additional similar policies in the same vein and in the same spirit that the ones we have are in place right now. I don't know why that wouldn't be an appropriate and adequate venue for addressing the emergency concerns. Two, I think it's a red flag. It will be a red flag, even with the provisions that Mr. Tripp put in, and I do support them. If really the only significant thing about this resolution, this declaration that we can't do as under normal business kind of, or with current policy, is that the county manager has emergency powers. I think it's going to raise an unfortunately discordant discussion that's going to bring a lot of unnecessary confusion and conflict that we don't have to have. And then third, the resolution, as it's currently stated, and I haven't looked at it that carefully, but it talks about an emergency, Dunn County declaring an emergency. But the only actions we're taking deal at this point in time, and I think we intend to take, are dealing with our county operations and our county employees. It would be better, I think, to phrase the resolution so that it was clear in the statement that that's what we were dealing with. We were not declaring an emergency in all of Dunn County for all of the businesses, and then later on explain, oh, we didn't. That's really not what we're doing. We're actually just dealing with county employees. I would think it'd be better if we addressed, and maybe I'm wrong, but maybe address that up front. So those are my concerns.
Any other speaking? Before we vote on the motion that we have. If not, are we ready to vote then? So all in favor of moving this resolution to the county board, say aye.
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 Opposed?
Aye.
On the notes, I have Supervisor Quinn, Supervisor Anderson, and who else?
Why don't you raise your hands if you said no, please?
Mr. Chair, I request a roll call vote.
All right. Mr. Miller, do you want to
Sure.
request a roll call vote?
Okay. On the motion by Supervisor Tripp for forwarding the resolution declaring the state of emergency as amended with the additional language on consultation with the Public Health Director, County Board Chair, HR Director, seconded by Supervisor McCullough. Supervisor Steen,
Yes.
Supervisor Anderson,
No.
Supervisor McCullough,
Yes.
Supervisor Johnson,
Yes.
Supervisor Headland,
No.
Supervisor Morehouse,
Yes.
Supervisor Quinn,
No.
Supervisor Maves,
Yes.
Supervisor Tripp,
Yes.
Chairman Bartlett.
No. All right, it passed. Correct?
Yes,
Okay.
6-4.
All right, thank you. Good discussion. Moving on to number 9, review of reports, resolutions, and ordinances coming to the county board from the standing committees, from the Health and Human Services Committee, resolution for the CDBG-CV application. A lot of stuff in there. Supervisor Morehouse, do you want to?
Yeah, certainly. And I see that Chris Corpola is
Oh,
here
okay.
with us if she wants to add
Sure.
additional detail. Hi, Chris. This is an application to CDBG, which the board is required to approve. Health and Human Services Board has approved it to essentially expand at the invitation of the Department of Administration, our existing CBDG-CV grant, which is providing transitional housing and case management
Wait,
during the
Diane,
COVID.
Diane, can I interrupt you?
Absolutely. Was I doing it wrong?
Yeah.
Sorry. These are related to the housing planning grant. These are,
I thought the citizen participation was for the CDBG CV grant.
mm-mm,
Okay, then I'm
housing.
wrong. Then
yeah,
I'm wrong.
housing.
So the board needs to authorize then a resolution that allows us to go forward with the housing study, which the Health and Human Services Board approved and the county board approved way back in June, I believe. Going forward with the county participating, the village of Boyceville and the city of Menominee. Go ahead, Chris.
So actually that there's two pieces. One is the authorization for submission by West Central Regional Planning of the CDBG grant for planning, of which Dunn County's part of the match is paid by a grant.
Correct.
And then the second part is because when we passed a citizen participation plan for the current CDBG COVID grant, we didn't include all of the other kinds of CDBG funding that you might need a citizen participation group for. This, the second part, the second resolution establishes kind of a standing citizen participation committee for any kind of CDBG application. And in this particular case, to cover the submission of the planning grant.
Thanks for correcting me. I appreciate it.
Any questions? Not? Thank you. And you kind of explained item B there also. Correct?
Correct. Yes, we did.
Yeah.
Yes, we did.
I mean, there's nothing to add. That's
I don't think so unless there are
All right.
questions.
all right. Then we'll move on to item 10, reports from the standing committees. Starting, Mr. Anderson, you're on the top row. We'll start with you from CRT.
Thank you, Mr. Chairman. Very briefly, two things came up at our meeting Monday evening, and you were there, and County Manager Paul Miller joined our committee, which we appreciated. The two things that are important, I think, to everybody, is that we're talking about our Dunn County tourism, rural tourism plan. And we put together a kind of exciting program, and we requested that we present that to the full county board at our March meeting. So that will be on the agenda, and all of you will have a good chance to see what our plans is for Dunn County rural tourism. I'm very excited about this. And the other item, we talked a long time about plans for broadband within Dunn County. A great discussion. It's going to take some more work, at least from my standpoint. We had a great discussion, and regarding broadband, one of the things that will be coming up forward, I believe, will be to ask the county board, you people and supervisors, if you feel that ARPA funds, if any of it should ever be applied toward broadband services, which would go toward matching in a small portion what some townships have done. So, Mr. Chairman, we had a good meeting. I don't have any results or motions that were passed, but we're going to be continue to be pursuing that. That's the end of my report, Mr. Chairman. Thank you.
Thank you. Supervisor Johnson, the neighbors. And you are muted, Brian. There you go.
I sounded pretty good for a second, didn't I?
You did. I thought it was going to be short.
Thank you, Mr. Chair. Our last meeting was December 16th. Administrator Meyer provided a cost comparison of raising wages and admitting more residents. See if that would possibly help out the situation there. as far as admitting. She also provided quality assurance updates to the committee. In employment, as far as employment goes, we had 6 new hires and 4 resignations. There was lost time, of course, due to COVID-related issues. Facilities is receiving many referrals. The facility is receiving many referrals, as very few SNFs are accepting admissions. Administrator Meyer discussed the census at the end of November, and it was at 90. Arrowhead and Fireside remain closed at this time. They are not taking any admissions at this time. They had a Central Federal Look Back survey, and they had a few minor citations for life safety, which they were minor. Discussed COVID-19 updates. Positive staff cases are being reported. Vaccine mandate is not being enforced at this time. And that our next meeting will be January 19th. That's all I have, Mr. Chairman.
Thank you. Next on my list is Supervisor Morehouse for Health and Human Services.
Thank you, Mr. Chairman. We last met on December 16th. Our next meeting is the 27th of January. We had 2 public hearings, which accounts for my confusion earlier. We had a public hearing on the CDBG-CV grant. And Chris did a really excellent job of updating us on both the performance and the intended plans for expansion on those transitional housing and case management plans. And we also held a public hearing on the call it the expanded citizen participation plan. We had regular staff reports, always excellent. We spent, of course, a lot of time talking about COVID as we do. We also had a very nice update on WIC and how the program has managed to sustain itself and provide really excellent services to women and children during the past sort of difficult 2 years. We approved vouchers and had little discussion about that this time, given some changes in the way that we've reported. And we passed the 2 resolutions, which we've just discussed here. And again, as I say, our next meeting is the 27th. Thank you, Mr. Chairman.
Supervisor Quinn, PR&D.
Thank you, Mr. Chair. The committee met Tuesday last of this week. It's been mostly business as usual. We did have a public hearing on Tuesday to consider a request to rezone a property on Highway 25, going north out of Menominee. Before you turn to Jake's, there is a business up there that operates a coating painting business, and they were requesting a rezone of some additional property they own along the highway from general ag to commercial, to allow them to have more space to operate their business. The committee voted to deny the request on the basis that this was the property that use in the area was trending towards residential, and this would potentially insert a long-term conflict that might cause significant problems in the future. The intention of the committee, and that'll come before the board at next month's board meeting. So you'll have to either ratify that, take action on it, formal action on it. I think the intention, just so you know, the intention of the committee is to try and find a way to accommodate the needs of this business in a manner that wouldn't require rezoning. So we're going to be working on that and seeing if that's a possibility. Other than that, I think the only the PRD committee is the committee that has the budget for the Red Cedar Watershed Conference, and both Chase and I sit on the planning committee for that. And at the meeting on Monday of this week, it was decided by the planning committee to cancel this year's Red Cedar Conference, largely, entirely because of the complications of COVID that may not allow it to be in person in a safe manner, and the difficulty of holding a meaningful conference like this over Zoom or over other internet is really difficult. So that conference will be canceled this year. That's all I have.
Thank you. Supervisor Maves, Facilities.
Thank you, Mr. Chair. We have not met since our last meeting, so I have nothing to report other than the next meeting is on the 26th of this month. Thank you.
Thank you. Supervisor Tripp, Judicial.
Judiciary and Law has not met since our last meeting. We meet on the 24th. I anticipate the sheriff is going to have some things to say about COVID in the jail. I anticipate that the court system may be impacted by the recent upsurge in COVID. So we can thank our lucky stars that so much of that electronic equipment is in place now for remote testify, remote trials, things like that. Otherwise, no business that I've heard of, at least so far. Thank you.
Okay. Supervisor Headland, admin.
Thank you, Mr. Chair. Yeah, admin has not met since the 2nd of December prior to our other executive meeting. Our next meeting for admin is scheduled on the 27th of this month. And beyond that, I have not had anything except we have been doing a lot of discussion with the libraries.
Okay, thank you. Supervisor McCullough, Highway.
Routine operations for a lot of things. We had 2 points of discussion that are probably of interest. We continue to discuss the budget deficit issue that the highway department has, which you've all heard probably more than you want to about, and I'm sure you'll be hearing more about in the future. And then the other one that we discussed was a new official snowplowing policy to give us a little more flexibility to not necessarily put trucks on the roads if we get, a 1/16 of an inch on the weekend. Hopefully that'll save us a little money, but we do have enough flexibility. So if we're going to have a very light snowfall, but it'll get cold and get caked on, we will go out there and get it done. And that would be the total of my report.
All right, thank you. Supervisor Steen, you have a question?
Yes, Kelly, how's the salt usage out there in Hawaii?
It comes blowing in on the wind. So, the roads salt themselves.
All right. At this time, we'll move to number 11. And I need a motion to go into closed session. I have Supervisor Johnson moves, Supervisor Morehouse seconds. I need a roll call vote. Mr. Miller, do you want to take the roll?
You're muted, Paul.
I am indeed. Supervisor Steen,
Yes.
Supervisor Anderson,
Yes.
Supervisor McCullough,
Yes.
Supervisor Johnson,
Yes.
Supervisor Headland,
Yes.
Supervisor Morehouse,
Yes.
Supervisor Quinn,
Yes.
Supervisor Maves,
Yes.
Supervisor Tripp,
Yes.
Chairman Bartlett.
Yes. Nick, would you